we're all here for Liniments, right? That's what this is called, this block of time. And I think a lot of you have experience with some Liniments, right? This isn't totally, yeah.
Can I record this?
I already am, but you can too if you want. Yeah, go for it.
Okay, thanks.
Sure, thanks for asking. So, is anybody new to Liniments? Like you've never had a liniment on your body? Yeah, I didn't think so. Okay. And then where are we in terms of, like I know some of you specifically do like healing work and things like that. Everybody here's into martial arts in some capacity. Come on in, yeah.
Sorry.
You're all right. How many of you have used Liniments not on yourself, like on a client or a student or something like that? Yeah, okay. So this is pretty much like, we don't need to just, it's not just us trying to like not get banged up. It's like, how do we take care of other people with this stuff? So obvious caveats, you know, I'm not your doctor or, and I'm not pretending you're a doctor and whatever. So you got to still be smart legally with things and what kinds of problems you take on. That's part of it with dojo medicine though anyway, right? You know, I mean, sometimes somebody gets a little whack or something and you got to know when they need to go to the hospital. The thing with liniments is that they're a lot easier to use because they're external. So you put them on your skin, you don't eat them usually, right? Don't eat them, don't spray them in your eyes, no mucous membranes, that kind of thing. And that gives you a bigger margin of error of being wrong in terms of what herbs you should use with people and still not have a catastrophic thing happen, right? Like Eastern, my background is Eastern medicine, so a lot of the herbs are things that people ingest. And when you screw that up, it's actually a real problem. And a lot of people think herbs are like natural, so they're safe, and not a lot of them. You know, actually there's this thing with medicine where I like it because you can screw it up. So that means you gotta kind of be sharp and you gotta be able to walk the edge of it responsibly. And not make mistakes, because if I couldn't screw it up, then I also feel like there's the other side of it, like, am I really doing anything? You know, if I can't do it wrong, what kind of impact am I really having here, right? So you get all that stuff with the internal herbs, it's kind of a bigger deal. But when you start using liniments, I mean, really like anybody can learn to use these. I have like an hour here, and I think probably within the first 5 minutes, you got it, you know, especially because my approach to these things is to take as much complexity as we can and just simplify the hell out of it so that it's not this big thing. And times are changing. I'm aware that in the past, of course I wasn't alive for a lot of this, but a lot of these lineages and martial arts things, information was very closely guarded. So you'd have secret techniques, closed door stuff. You'd have secret liniments, secret herbs, secret. And I believe that we're on a turning point with value delivery. This is a little bit beyond our talk here, but like it seems like a lot of the information is loose now. Information wants to get out. We have the internet, you have YouTube, we have Xerox machines, right? Like things are moving around. And so when we try to hold on to the precious secrets, it actually does more harm than good. It's just gonna stagnate when it wants to move, right? And it's really a weird thing because if we come up through a lineage where that was the way it was done and there's kind of a value to that, especially if you were on the other end of it, where it's like, man, I had to sweat and work and bust my ass, and then they finally showed me the secret elbow touch or whatever. This is now like what you teach a beginner on their first day, you know, and it's like, oh my God, I suffered for that, right? But we got to get past that like suffering equals value kind of thing and just realize that information wants to move, and it is, and we can't control network effects. It's like trying to squeeze water, and it's just the harder you try to hold on to it, the more it shoots through your fingers, and then the more of just like a jackass you look like, and nobody wants to hear anything. You know, it's hard to let that stuff go. But I think with the liniments and things like that, it's another one of these things. I'm trying to like say this with respect because I know we come from traditions where people have their like little kind of secret lineage stuff, and that's great. But for the most part, for the 80-20, to get liniments to do what you want them to do, you don't need most secret things. You just don't, because this stuff's out there now. It's freely. We're going to talk to Mark, who's pressing out artisanal versions of like a off-the-shelf formula. I mean, there's cool stuff kind of everywhere. So, if you want to understand liniments, you got to understand the human body and why it would need them and when. And one of the best things to do is to take, while this may not be perfect, but I really like this kind of stage approach. Does anybody know like the 3 stages of physical injury healing off the top of your head? When I say it, you're going to be like, yeah, of course I know this. You already know it. You just probably aren't thinking of it this way. But initially, our first stage is like, you just had an injury, right? You get the 4 inflammatory signs, right? Like swelling, pain, heat, and what's the other one? There's another one. Yeah, that's it, right? I'm colorblind. I don't mess with that. So, yeah, the 4 stages of bad, right? And, that's the wrist is blown up. You can't move your hand. It's loud, right? And then we get to that kind of, once the initial fire has calmed down, you get to this second stage where there's still problems. You might still have the big bruise, still hurts, that kind of thing. And then there's a third stage, which is more like a lot of the chronic stuff. Does anybody here have like my bad ankle or my bad knee? Like, ever since that car accident, I can't turn my head. Yeah, sure. Right? Yeah, this is a common thing, right? A lot of the people I work with like complex inflammatory conditions have this stuff. And I had to kind of bash my brain on this for a while to start to figure it out, but it's a continuum, because when you have a physical injury like that, you get that first big hot wave, and then you get it starts to kind of cool down, there's still problems, and then if it just kind of keeps going, that's where you get this like my bad knee stuff, my bad ankle, whatever else. And a lot of people that have inflammatory issues like Lyme disease or like mold exposure or whatever, they don't have a proper immune response to navigate those stages. So that's why that third one tends to linger a lot. And with Eastern medicine, like when I was first learning this stuff, they would call it B syndrome, and B means like impediment, blockage. So we got this idea of the channels, and there's all this like happy flow going on, there's some blockage, and that's why you have pain, right? But we start to look at this and go, hey, where are these blockages coming from? And a lot of times, not always, but a lot of times it's a physical injury. And so people with fibromyalgia that are in like 6 different car accidents within a year for some reason that aren't their fault. It's like this bad luck Wei Chi kind of thing, just getting rear-ended, going through 6 cars a year, and they've got things that won't heal. There's all these kind of patterns, and depending on where you are in an injury process, you can set yourself up with leverage so that you don't get the my bad ankle, my bad wrist kind of thing. Like I broke my ankle when I was 15, and the medial malleolus is like twice the size of the other one, because I didn't know any of this stuff, and I was doing just regular doctor stuff, ice, cast, immobilization, whatever, and I got this huge thing. But it's because our body puts down scar tissue, is trying to be efficient, right? So we have enough demands on our body to heal and repair things all the time, and the more kind of weird stuff we're around in terms of environmental inputs and whatever's in your food and whatever, right? There's lots of stuff out there. That's a stress load. So if you have an injury, then your body's not necessarily going to devote like 100% of everything to get your ankle totally 100% perfect. It's going to go good enough. Scar tissue, lay it down. He can limp, right? But he can live. That's kind of the thing. So with the herbs and the liniments, if you can intervene in the right ways, in the right stages of healing, that's when you get these leverage points to give your body like that better probability of not knowing you had an injury. I don't want to think about this 10 years later and always remember that time I fell. It's just like, you can undo it. It's just the longer time goes on, the less leverage you have, right? So we're looking at our stages. So when you have an acute injury, typically you get all the hot signs, right? The big 4. And what you'd look at there, conventionally they would say ice it. This is where RICE comes from, right? Rest, ice, compression, elevation. And is everybody familiar with this whole like ice controversy?
Ice is for dead people.
Yeah, there you go, yeah. So it's not that black and white, but this is one of the cool things actually with ice and injuries. This is one of the coolest things because this rarely ever happens where somebody makes a big name for themselves in the medical field and then 40 years later goes, I was wrong. And they actually say it. Really cool. It's this Dr. Gabe Merkin is his name. And he wrote a blog post, I don't know, like 10 or 15 years ago where he was like, guys, I know I wrote the book on rehab and rice, but I've been doing this now for a long time, and you need to stop listening to me on that, and we need to go to the other thing. So the big wheels are turning with like conventional wisdom, but it's the icing and the complete immobilization, the complete rest is actually turns out to be a problem. We need some movement, even when you first get injured. and your ankle's the size of a watermelon and whatever. You still should be like trying to draw the alphabet with your toes and just doing all these little things. Micro movements, don't hurt yourself more, because that's hustling backwards, but you got to do a little bit, because that pulsation helps the fluids move in and out, right? And ice is the same thing. Ice feels great because it numbs when you have pain, and that's the trap, because you can't feel the bad part. It just feels numb. If you put heat on a freshly aggravated injury, it's repellent. Immediately you're like, dear, get it off me. I don't want anything to do with this. But ice doesn't give you the same feedback because it's just cold to the hot, right? So we lose some intuition there. So we have to kind of just understand how things work. And if you ice, you can use ice like up to 72 hours after a fresh banger, right? Something gets really tweaked. But after that, just stay off it. And even if you're going to use it, you can alternate with heat too, because we need, for things to heal, we need fluids to be coming in and out of the area. And part of the deal with the swelling is that it keeps you from moving the limb, right? It's protective. Another thing with swelling is that when you send fluid to an area, it acts as a thermal buffer, so it's going to absorb some of that heat. So everything's getting like freshly inflamed. If you ever got a burn, I mean, what happens immediately? It's like this bubble. Remember, I was at a sushi restaurant working there, and one of the sushi chefs got burned, and it just like instantly, just his finger like doubled in size. And I mean, we all dropped everything, not to help him, but to watch. It's like, oh! But why is that, right? Because there's like way too much heat, thermal damage. Your body's throwing fluids there to just try to absorb some of that energy. It's just a calories thing, right? So we can get the same thing, but we're generating our own heat from inflammation. So you want to have the fluids there, but you also want to have them moving. And that's where the ice kind of gets tricky. So a lot of people go, okay, well, like, now I don't know what to do because I can't put heat on it because it's hot and mad because we're in that first stage. I'm not supposed to put ice on it because ice is for dead people, right? This also comes from like China and places where they didn't, I mean, if you were going to have ice, it's because somebody like brought ice from a glacier in a thing. Like it wasn't just like in your fridge. Yeah, you know?
Go to the freezer.
Yeah, so they figured out other stuff. So we have like this kind of powder, if this stuff, you can smell it or whatever, but if it gets out, it'll stain your clothes and stuff. But this is pretty straightforward. Yeah, it's like a bitter powder, and it's yellows. Golden yellow powder, Jin Huang San. You guys are probably familiar with this in some capacity.
Same one thing.
Yeah, same kind of thing, yep. And there's different versions of this. There's not the master's formula with like 3.2 grams exactly of whatever, but you can pass it around, take a look. It's all yellow herbs. Some of the things are like dandelion could be in there, right? Things like that. And what you do with that is you would just make a poultice. And you can use any kind of liquid medium you want, and you make it kind of muddy, and you put it on the injured area, and then you wrap it with, well, I like for this, I would just put saran wrap over, like plastic wrap, and leave yourself a good margin so you're not gonna spill it, and then an ace bandage over top of that. And basically what you just don't want it getting out, because you want to go to bed with this stuff on, and you'll wake up, it'll be all over your sheets, and your wife will be, now you got another injury to deal with, and then you're just doing so wrap it up, right? You can leave that on for like 12 hours, something like that. Give it a rinse, put a new, if you make too much, you just put it in the fridge, which is kind of cool, because then you put it on, you're like, oh, I know I'm not supposed to use ice, but like, all right, this is nice. Those kinds of herbs actually, it's just like a watermelon or a cucumber. Like you've got room temperature, but there's specific heats of things, right? So like if it's summertime and it's hot out, but you cut open a watermelon, it tastes cool, it feels cool. It's just the way it is. It's how it handles heat. And a lot of those herbs are like that too. And if you're ever in a pinch, you can just use dandelions. I wouldn't get them from a place that probably sprays this, if you can. But like once when we had just had our first baby and we were out in Asheville in the mountains and trying to take like a nice walk, and Marissa's like got mastitis because breastfeeding and all this stuff. I'm sure she loves me telling this story. But I was like, oh, you look uncomfortable, and I grabbed a bunch of dandelions, I chewed them up, and I just like made this thing, slapped it on there. And immediately she's like, it feels cooler immediately. But that's the nature of those plants. They just do that, So I got to MacGyver a boob poultice out of chewed up dandelions, to try to use this information for something. But I mean, you can start to do that stuff too. So things like the poultice there, San Huang San or Jin Huang San, there's different names for it. I like that. I just get the herbs ground up and I keep it in a jar, and when we need it, I make some. But there's a guy named Will Sheppy who makes herbal ice. And it's like a ointment that's made out of that. So you can just have it in a can. And there's other people doing it too. I like Will, and we talk, and I think he's a pretty sharp guy. So there's different ways to administer it. But that's the idea. You use something like that instead of ice, because now you're getting that anti-inflammatory kind of ease down without trapping everything in. Is this making sense?
Yeah.
The other, yeah, sure.
Can I want to throw something back at you.
Oh, great, yeah.
But it has to do with the rice ice controversy.
Uh-huh.
So I know that
Thanks.
I've heard a number of Chinese medicine practitioners say, liquid water ice is bad, and so you need to use herbal ice. And that is from the point of view of Eastern thinking and Eastern pharmacology. But what happened to the Western physiology idea? Not that it numbed it or it retarded the swelling, but that the after effect of the ice was to increase the blood flow, which would go in and remove a lot of the broken down cells and bring in more building products for repair. What happened to that concept? Why is that wrong? What is wrong with that?
I don't know that it's wrong, but I would say it's contextual. So you've got, does everybody know the word hormesis?
No.
Okay, you probably know the concept, if not the word. Hormesis is give a little stressor to something, don't break it, and it'll get stronger after.
Okay.
We all know this because, like constantly low amplitude stressors over time, and our body will push back in the other way. Basically, like if I keep doing things to my bones are gonna go, okay, I need to get stronger. If I do cold, like when we were living in Washington, I was out there, we were talking about the spa and stuff. I would go out in Puget Sound in the wintertime and just stand in the water up to my neck and like not shiver, I'm gonna control this, and get out, and you feel these waves of heat going over your body. And it's like, how am I so hot and so cold, right? At the same time, after getting out of this frigid stuff, right? Well, that's what's going on. It's hormesis, because you give your body that cold shock and your body pushes back and goes, all right, I'm going to just do some neovascularization then. If we live in a cold place and these are the inputs, here's how I'm going to respond. And over time, you get that cold tolerance and you just can go in the thing and you're like, it's still a little weird when you hit the root chakra gets wet. It's still like, but after that, you get you build up a tolerance, a habituation. That's easy to do when you're in a healthy, stable state. As soon as something's broken, our hormesis isn't so good. So like that cold plunge is not a good idea if I've got a fever, right? Or like, I'm sick. If I've got food poisoning, I don't want to go in to do the health longevity hormesis, like push my luck kind of practice, right? Just like weightlifting or anything, right? You dial the amplitude down of the stimulation. So they're right. There is a physiological response to icing and cold therapy that actually your body creates the heat, which is badass and really cool. And that's one of the things, this is nuanced conversation, because like ice is for dead people, kind of. Like you can go to the land of the dead and you come out like, it feels good. And like Wim Hof's got a whole career on, there's all this stuff. That's when we don't have any issues. That's easy to deal with. The trouble comes when there's a pathology like an injury or something like that. Then it's like, okay, well, do I have the capacity right now in this injured area to lay down and ramp up what I need to do based on the cold stimulus? I'm not sure. And I'd have to look at more like literature or studies on that. I don't want to give you the wrong answer, but that's kind of the way I've been thinking, because I ask myself the same question, right? Because it's like, I know how this stuff works. You give a little bit of poison, you chew it up, and you're stronger, right? Just don't overdose. The thing is, when your threshold's low because you're injured, it's easier to overdose the stimulus. Right? Like, okay, here's another one. Forget hot and cold. Exercise is good for your tendons. Right? So you just broke your ankle, so jump rope. Your body will feel that, and your body will build up more tendons. But it doesn't make sense, right? But the reason why it doesn't make sense is because you're not in a position for hormesis. You're like, you got to get back to neutral before you can do like tendon strengthening stuff.
So
does that make sense?
It does make sense, the way you're portraying it and saying it. I just wonder about the fact that the natural, this is this whole idea of like looking at a physical system like the body from one perspective or the other, or trying to straddle both.
Yeah.
When you look at it from a Western perspective, I think that physiological response of, in response to the cold, of sending heat there, and thus increasing circulation and so forth, is part of the way the body actually heals an impact trauma or a trauma. So maybe it's a question, like you say, it's nuanced. Maybe it's a question of degree and subtlety and timing. I don't know, but this idea that everything is so absolute that people say, oh, we've been doing this for the longest time and now it's bad. Well,
yes.
It wasn't bad and it worked.
Right.
For a very long time, so come on.
I think this you're getting to the answer to your own question, at least for what we have now, is that the guy who promoted this has turned around later and said, you know what, it doesn't, however this works, empirically I'm noticing my patients are getting better results if I don't ice them after 72 hours. So we've got to figure out the mechanisms there.
Okay, all right.
And then there's other stuff too of like, how does the body heal? We've got a mechanical understanding, but then there's this whole like electromagnetic understanding of the fields that guide the laydown of new tissue. And like I went to see Prof and he just had his neck operated on. He's got this rig, this like pulsing EMF thing to put certain frequencies to help his bones heal faster. What's that? Well, that's helping with like take a magnet and then you can put the filings on and now the field is like revealed, right? It's that same kind of idea. Like we have the same underlying fields guiding our particulate structure. So, there's a lot of stuff, basically. It's kind of what I'm getting at. It's a lot. And you've got I think your question's cool and you've probably been thinking about it a long time. I know I think about this stuff too, and it's like, I think it's contextual and it would be easy to do too much ice and not know it. So it's almost better, if we don't have a calibration, it's almost better to just lay off it. Because you're already going to be creating heat there. It's already red, right? That kind of thing. So
here's what I would say, Jeremy. I've used ice on injuries, post-injury and at various stages. And as a rule, I've had good results. And for the very first time, I had an injury not too long ago where I blew up my knee. And I'm like, I'm not using ice. And I got San Juan. And I did exactly what you described in terms of treating it with San Juan. It worked great. But what worries me is becoming this sort of true believer that all of a sudden goes, I must have been in a dark place all those years and now I see the light.
Yes.
And I'm going to go this way now. And without thinking about what's still good about this and what parts of it are good.
Yep.
And being so absolute in my conversion.
I agree. Yeah. Don't guzzle the Kool-Aid, but you can have a sip.
Yeah, have a sip.
Yeah. Because I'm not going to tell you ice is bad all the time forever. Because I'm the one. How hypocritical would that be? I'm out there standing out in the freaking water in December. Like everything's got. It's. One sec. But this thing about like information wants to get loose, right? This is where we're at. And this is a big part of like the work I'm doing kind of online and with health professionals and stuff is realizing that information's gotten loose. The facts are everywhere, but people don't have context and structure for these facts. So if you go to Google, you're going to get your 10 billion results. But where do you start? It's overwhelming. There's conflicting stuff. And so you've got to have, the value comes now, you've got a structure. Oh, Mark. The value comes with a structure, being able to organize all that shit. And this is what you're trying to do is go, okay, so cold is good, cold is bad, when, right? And maybe we'll talk to him about this too.
So, okay, what happened is about 5 years ago, there was a prominent physical therapist that's around 30 years old. He wasn't really well read, he was just well known. And there were these three to five different studies that came out. These studies were by anti-inflammatory companies, and they basically said ice is bad. And they proved it. They proved microscopically when you put ice on the body, it does bad things, right? Okay, so I used to teach very extensively on hydrotherapy, heliotherapy, electrotherapy, and I actually know that that is true. The magic of ice is not when you put ice on the body. The magic of ice is when you remove it. So when you remove it, you get a flood of oxygen, you get a flood of red blood cells, you get a flood of heat, you get a flood of white blood cells checking for damage. So while ice isn't appropriate for every situation, I do think that it's a very good tool that can be used. I think in a situation of acute trauma, if you don't have herbal ice, I think ice is going to be better. I think if you have herbal ice available to you, it is going to be better than that, because you're actually not only getting in the influx of blood and red blood cells, white blood cells, and all of that, but you're also getting the herbs delivered straight to the area, which is a big deal. You're giving it more than the body could do, because with ice, it's just activating what the body can do for it. So yes, I think your initial thing was correct, not to vilify ice, but just think of it as a tool, and it's not a tool for every situation. But yeah, they failed to mention that when they were talking about the different studies. But if you look at the studies, they're it's very obvious what the goal was with that. So
Kind of a red flag.
now, and I will mention, not everybody's going to agree with me on that. That's just has been my opinion from experience.
Great, thank you.
No problem.
So can you take us through bone water a little bit?
Yeah, sure. So I don't know how much you know about Shungu Shui or evil bone water. Are you familiar with Shungu Shui at all?
Yes. We've been using it for years here.
Yeah. Well, and so was I. Since about 1995, I was using it and very happy with it. It took a hit in 1999 where they removed senshi, which is what's in Yunnan Baiyao, pseudo ginseng, tianchi, senshi. And I was bummed about it, but it still worked really well clinically. I used it with most patients. Took another hit, I think, in 2008, where they removed a few more herbs. Around 2001 or 2, kind of another hit, and the prices started going up, because that's right around when, 2011, 2012. It's right when China started kind of embracing their capitalism, communism model, and it was really working for them. So at that point too, I'm almost positive that they started adding some food coloring, because some of the herbs that they took out were probably what was giving it that color. And now, after having made it weekly for 6 years, I can tell you that there's certain herbs that make that color, and it can't possibly be always consistent unless you're using them. But still, not a bad formula. And then what finally happened is in 6 years ago, I got my invoice for my clinic order, and it was up to like $12 or $13 a bottle wholesale. And I've always done herbs. I'm a master herbalist. I'm not making anything for $5 or $6 a bottle. But when it gets to be, like $14 a bottle, I'll try to make it. So basically what we did is we spent about 6 months researching the original formula. I mean, if I'm going to do something, I don't want to just solve the problem. I want to solve the problem better. That's always been my experience with things. Let's not just do it. Let's do it better than we possibly could. And it took a while. There's some of the herbs that it was like a 20-plus herb formula. It's a 500-year-old formula, supposedly national treasure. I didn't get that till later on. Owned by one family up until the Chinese government kind of traded it for one of the family members' lives. So now it's their national treasure. But anyway, so a lot of the herbs were things that were local to the guy's town. You know what I mean? So it was like something that grew, just very, very obscure, hard to find things. So where practical, I found all of the rare, all of the expensive herbs, all the ones that are hard to find, brought it back up to 11 ingredients instead of, now I think in America it's got 5 or 6 ingredients. Brought it back up to 11. Decided to make it with Everclear 190 instead of commercial ethanol or isopropyl or anything like that. Everclear, all the oldsters used to put that on them for medicinal purposes, whereas commercial ethanol is listed as toxic and doesn't really have any, medicinal purposes. And so anyway, I just put out some videos about how to make it, and within days I had thousands of people watching them. I couldn't imagine who'd be that interested. And I also not only had thousands of people watching it, but asking me questions, and the main question was, can I buy some? And so I just flippantly said, well, if you buy a case of 24. Well, skip forward 5 years later, and now we're in 1,800 clinics. We only sell cases to acupuncture physicians, or sometimes we make exceptions to that. But yeah, we're done advertised. We're all over the world now. We're in every state, every province. It's kind of crazy, and it's because of one of the things that we did originally. Cinnamon is not cinnamon is not cinnamon. We decided that we were going to use actually through connections with Jeremy, through Andrew, Botanical Biohacking as our agent, to make the highest possible quality that we could. And to do that, the herb orders are quite large. I think the minimum is 75 kilos, which if you know anything about ordering herbs, normally if you order like a pound of everything included, that's a lot. But we were like, what the heck? Let's just do it. So anyway, the difference between normal herbs and imperial grade herbs is vast. So I'll give you cinnamon as the example because it's the one that most people would know. So most flavorful cinnamon comes from Sumatra, a small area of Southeast Asia, and it's trees that are 1 to 3 years old. It doesn't even get medicinal until it gets 5 to 15 years old, and then the medicine migrates out to the barks and the twigs and the stems. After 15 years, the medicine migrates back in and goes to the bark. So mostly in America, all that you can get is the best that you could possibly get usually is from 15-year-old trees, and it's the stems or the twigs. We are getting 30-year-old bark from the mountains of Guangdong that has been in the right soil, it's been from the right region, it's harvested at the right time, it's been cared for the right way for 30 years. Yeah. And you break that, and you don't just smell cinnamon. You smell all sorts of things that are all familiar because they're all medicinals. You can smell everything from camphor to menthol to the whole bit in them. And so that's what we did. We just decided to make it with an ever improving process, just with as high as quality as we possibly could. And so it's become a whole lot more than we intended it to be. And I think that's what the problem is with most of the regular jowls that are out there and things like that. Is that I've always read, oh, well, just put scrap herbs in there. You know what I mean? Or just do this, or just do that, or just use the dregs for this. But why? I mean, if we can make it where it's absolutely extracted to the highest quality possible, not only do we get a better effect and a much more universal effect, everything from burns to hemorrhoids to infection to whatever, but we get it safely. Like with all the hundreds of thousands of bottles, we don't have any people having reactions or allergies, even if they're allergic to, say, cinnamon. So I guess my mission, I'm only going to make one thing, that's all that I do, and it's quality. And where it comes in with like martial arts, I still think that, say for instance I was training in martial arts every day, I'd probably still use Shungu Shui to an extent, but I'd pick and choose when I use things like this. One of the things that we've noticed with Evil Bone Water is it is an excellent carrier for other things into the system. So say for instance it changes skin permeability somehow. Say for instance that you use a topical CBD. If you use Evil Bone Water beforehand and let it soak in for a few seconds, whatever you use is going to be much more effective. In the case of CBD, it usually extends the pain relief by 2 more hours. And that's where you start to really get into doing good liniment work, or even work like you were saying, like with ice and things like that. It's how you layer, when you layer, and why you choose to layer, I think, is when you get really good. In my clinic personally, I'm almost always layering something. I use Evil Bone Water on most patients, but then I might use something like Red Emperor's Immortal Flame. I might use something like Posemon. I might use something like Yanhuso type preparation. I think when you get creative with it, you actually get healing to the area much more appropriately. So that's our little Evil Bone Water story.
If nobody has a question,
Go ahead, Gary.
could you speak a little bit about using it for first stage injuries, second stage, broken skin? You mentioned burns.
Yeah. So that's a big difference between Shungu Shui and Evil Bone Water. I'm not so sure that I would use Shungu Shui on an open wound, just because I'm not sure of what the ingredients are that are in it. I don't think it would hurt, to be honest with you, but I'm not sure that I would. But we use it on cuts and open wounds all the time, and infection all the time. It will sting for a second, but it numbs pretty rapidly, so it's always seems to be worth it. Also for wound healing and for prevention of that. So first line, if I can get to it, let's say for instance I get a bite by something, or let's say for instance I've got a cut, I'll usually put it on as a compress. I compress conservatively, so maybe a couple of minutes most of the time. You can compress for up to a couple hours. And I would say that if it was something like, say for instance, a tick. Well, first of all, if you spritz evil bone water, ticks hate it. But if you have a tick and you put a little bit on the tick's back, it'll back out immediately. It will let go, back out, and want to leave the area. But in the case of a tick, I'll usually compress for an hour. I just want to make sure that anything that tick tried to impart does not stay with me or stay active. So yeah, in acute situations, it's a good one to have on.
Very cool. Well, we just got like the 2-minute warning here. Does anybody have any questions?
Holy crap.
Well, we just got our 2-minute warning here, so I'm trying to see if there's any other questions before we get booted.
Are those videos still available?
I guess if I could encourage, oh, go ahead.
Were you taught how to make the formula? Are those videos still available?
What's that now?
You mentioned that early on you had made videos talking about how to make the formula.
Yeah,
Are those still available?
Yeah, and I think it's something everybody should try to make because it's a lot of fun, at least with the ingredients that you can get that's available to you. If you go to the Evil Bone Water YouTube channel, it's a video part 1 and a video part 2. The process has changed considerably since then. Like, it's very kind of complex now and complete. But that's the basics of it that I think anybody could do pretty successfully at home. And you can always make some modifications depending on availability of certain things. Like, there were a couple herbs that were hard to find, or you might not see the need to. I always say this though: if you modify something that has a lesser quality or it has a lesser effect, just use more. You know, that's your thing. So bump it up to the top of the range instead of the bottom of the range. There's some things that the quality is so good on, I just use near the bottom of the range or the range on. But if I ever had to substitute anything, I would pump it up for sure. And so with this too, it's interesting for you. It'd be interesting for you guys to watch it because we do something really weird that speeds up time. We do a traditional water decoction, but then we do an alcohol extraction. And if you do that right, you can get equal results to sticking it in the ground for like 6 months. What you can't get is there are unique compounds that are made the longer something stays sitting. And we don't know exactly what those are. So it's just the same thing like with a bourbon. With a bourbon that's been sitting in a barrel for 5 or 10 years, all of a sudden it develops these flavors that you really wouldn't expect in it. Like, I don't know how there's caramel in this one bottle, but there's caramel in it somehow, or there's apple in it somehow. You don't know where they come from. I do think it's the same thing with liniments to an extent, even though they don't have the barrel to interact with. But the combination, decoction, and alcohol extraction is a 10-day process that I think is about as good as you're going to get without leaving it for years and years and years.
Very cool.
That's great. Thank you for being
Well,
here.
Thank you.
you've sent some of these bottles. I was just going to give these out as door prizes here for everybody. Is that okay?
Absolutely, please do. I'd love for them to have them.
Very cool.
Oh,
Thank you, Mark.
so much.
You're welcome, guys. Take care.
So